Richard to speak to the room.
Yeah, thank you very much. And I do hear your stories. I mean, I've been a
You
doctor
might.
for, I do.
Yeah,
well,
no,
that's
you
why I'm
do.
here. So, look, I've been a doctor for 46 years, and I'm fortunate to be the medical director of Emerge Australia, and I've also got other hats and senior clinical lecturer at Macquarie University in the Department of Medicine, because we're working on trying to develop diagnostic biomarkers. Because if you don't have a diagnostic test, it's very hard to diagnose these conditions from history, and I want to talk about the doctor training. I've seen, I've been a lecturer for the last 3 years trying to train GPs through GPCE, Primary Health Networks, and through the College of GPs, and probably have got to about 3,000 doctors some way, and I realise how inadequately they're trained. I might have a lot of knowledge, but to impart to a doctor who doesn't even have even an inkling of this illness is really difficult. So I can understand how difficult it is for patients when you present to these people. In 1 week's time, I'm retiring, and I'm going into part-time research into ME, CFS and related disorders for the rest of my career, because I think that's where I'm best used. The national guidelines are coming in 3 years. Now, that's not helpful for this time now. That's great, and I think we need them. And absolutely, the guidelines 22 years ago were useless 22 years ago, and they are useless now. They did not address, they did not hear what was happening to the patients, and I've been involved with this condition for over 27 years. I've seen 6,000 patients in my career, and recently we've seen about 1,000 patients with long COVID in my group. 7,000 patients that I've hopefully had some positive impact with in the group that I work with. Look, 250,000 patients probably have ME/CFS, and it's a rubbery figure because we don't really know, and I'll talk about that later. But there's over 300,000 people with long COVID now, and half of them have the criteria to be diagnosed with ME/CFS. So there's an absolute number of people. It could be 500,000, it could be more. 90%.
The whole world needs to get sick to kind of recognise.
Well, that's exactly right.
Yeah.
But look, 90% of these patients, these people, do not have a doctor. 25% of them are housebound and bedridden.
75%.
That's
75% of them.
If
Yeah,
you just tick that, otherwise
60.
we will be here all day and
That's
the catering will kick us
That's
out.
60,000 people. So we obviously need to have some urgent funding for training of doctors. Every doctor needs to know how to diagnose ME/CFS and long COVID, because it's really important that we as doctors hear you, because one of the difficulties is it's not taught as undergraduates, we're not taught as GP registrars, and most GPs, being time poor, aren't encouraged to learn some of these evolving illnesses. Probably long COVID has given us an opportunity to highlight ME/CFS, but the training of doctors and the funding of that training needs to happen before the next election. It doesn't have, it can't be after the next election and then put off for a later time.
It's also specialists.
Now, there are clinical guidelines available already, and there are diagnostic and treatment pathways internationally recognised that I teach that are available now without a guideline. You don't need a guideline. That verifies what you already know. That's what a guideline's about. These are evolving illnesses, so these can be taught now by qualified doctors, training doctors to take up the baton of seeing individual patients and being able to go through a process of diagnosis. Because otherwise what happens is this medical gaslighting. Failure to diagnose, failure to treat is medical negligence. It's really when patients tell me this story over and over again, the first thing I say to a patient when I've spent an hour with them with ME/CFS, I say, you're safe now, you can stay here, I'm going to look after you. I suppose I'm in a privileged position because I chose to just see ME/CFS patients 27 years ago, but there needs to be more of us doing that, because this is a huge burden of people with a huge stigma upon them that don't actually have a voice and don't actually have a doctor. Now, let me finish. Then you can ask me some questions. So look, disability support pensions, NDIS, income protection, absolutely need to be improved and supported by GPs. But the problem at the coalface, the GPs don't know how to diagnose and give a representation to these organisations actually get this funding for individual patients. All the long COVID clinics in Australia are now closed. But I can tell you there's hundreds, thousands of people with long COVID out there. Now, 50% of people with long COVID get ME CFS, and the burden is coming back to those patients, and again, they don't have doctors. Now, to summarise, and then you can ask me some questions, the most important thing we need to do is fund GP education now, not next month, not next year, funding now to actually start the training process of all doctors, and that probably includes specialists. I think that should be something that we should be looking at straight away. The second thing is, like, I'm letting go, in my practice, 730 patients with ME CFS, and I finish in a week. 60 of those patients are housebound and bedridden. The only reason they get Medicare is I go to their house once a year to activate their Medicare and telehealth. We automatically need to change Medicare. So if you're stuck at home with with ME CFS or long COVID, you can't get to the doctor. There must be some provision through Medicare to provide funding immediately for those patients, and not to be gaslighted and told, oh no, you can't have Medicare because you haven't seen the doctor face to face. Well, that's got to stop. That could happen now. Just hang on now. The future also requires undergraduates, people training in medicine in universities, and GP registrars need to know about this illness. They need to be trained. I've been teaching students for years. The students that came to me all know about ME CFS. They've become very good doctors because they actually listen. The most important thing about looking after people with ME CFS, you've got to hear their story, you've got to give time to it. And the last thing I want to say is notification. If you don't notify an illness that's evolving, like ME CFS and long COVID, how do you know what the disease burden in the community is? So not only have we got to train the doctors, get Medicare sorted, but we've got to know how many there are in Australia, because it could be 250,000 and then 300,000. I saw one statistic, up to 1 million people could have long COVID. And if half of those develop ME CFS, we have a serious problem. And if we get more pandemics, we're going to have more issues. So thank you, and I'm happy to field any questions and advice.
I just want to add on that those people who aren't seeing doctors, and lots of people will choose not to see doctors, even if they can, because of the treatment. And that's their GPs, that's the specialists they need. They're also not getting dental. They're not getting pathology. They're not seeing the optometrist. They're not having pap smears, mammograms, like all these other things.
All that.
Like, there is no way that those people can access those things. So it's across other areas, and that impacts other health burdens.
I did have a question. Thank you, Richard. That's spot on. We 100% agree with you, so thank you for putting that out. In the middle there, you were talking about trained doctors, and the doctors not. I got the feeling from you that a lot of them, in their busy days, I totally understand busy days, and I have a fabulous GP who needs to be bottled and handed out. And I understand their pressures with time and Medicare and business and all that sort of stuff. But if we wanted to force them to have a look at what they need to know, can we tie it to their insurance?
No, look, I think look, doctors are time poor, but when I have been giving my courses through GPCE, 1 hour was spent on how do you actually work up a patient with ME CFS. So you might see them for the 15-minute consult. The second consult, they come back for half an hour, and there was a process of training and education that allows the doctor to actually start realising they need to give more time, more effort, and more continuity for long-term care of the patients with ME CFS, which could be lifelong. So I think it's not the doctors aren't interested; they're ill-equipped. They're not trained. They don't have the skill, and to have the skill, you've got to have time. So that's partly Medicare item numbers and things like this, which has been improved. The Labor government has given us a new item number called a 123, which is an extended Medicare rebate consult, and that helps because all chronic diseases need the doctor and the allied health. It isn't just doctors, it's everything.
It's complicated. Like, I've worked in the AMU medical school and the first 4 years of training, and like even with their complex cases, like there's nowhere near like what they're actually trained in terms of complex cases. It wouldn't even, you know, we're
Well,
down
we
here.
don't learn
relative-
complex medicine in undergraduate medicine.
No, but I
But we
mean,
learn it as postgraduates, and I just happen to have an interest in this area. And I don't have ME CFS.
The
I
thing
don't have a
is-
whole family
Yeah.
members with
the
this.
thing is,
This
this
is
is a large
interesting
section of the
intellectual
community, so I
stuff.
don't know how you get it in there. It's complicated.
Well,
It'd be more in your
but you
area.
need an intellectual input for doctors so they grasp you, so they actually fully understand
But
what's
it's-
happening.
I guess
for
it's like everywhere in the community where people come into contact, it needs to be an awareness within,
Sure.
and it should be told that these kind of conditions in undergraduate medicine. This is not a really obscure condition.
No,
I'm just double checking that before we move on. Do we have any questions online
Yes.
for Dr. Schloeffel, or can I let Richard have an early mail and catch us in time? We're all good? Wonderful. Thank
Okay.
you.
He's
Please don't.
retiring, doesn't he? Getting
Oh,
restless.
I don't think he's going anywhere.
I'm retiring into research.
So thank you. So I'm conscious